afternoon and welcome to another Lunch and Learn webinar with the VACRC, Victorian Aged Care Response Centre. This is number 4 or 5, so we are almost at the end of the journey, and I know that many of you have been with us right from the beginning, and I know that the feedback about all of these webinars has been fabulous. My name's Sharon McElwain and I'm the Victorian State Manager for Leading Age Services Australia, and I'm your host, so lucky me. Today's topic is PPE best practice. And I guess the question that we would ask, and I'll draw through this a little bit while we wait for people to enter the Zoom room. And before I go on to why we're discussing PPE, thank you, Megan, for the reminder. If you need any technical support, there is a Google joining and participating in a Zoom meeting. You can phone Laser's 1300 number, 1300 111 636, or conversely, you can email events. Recording and slides will be provided after the session, and we'll be taking questions via the chat function or so I know some of you have already emailed through some questions in anticipation of today's presentation. I don't anticipate that we'll be able to get to all of the questions in the time that we've got allotted today, but we will take them offline and come back to all of the participants at a later time, if that's okay. So why are we discussing PPE? Okay, well, there's a number of reasons, and look, I think the first one is that there's been a lot of questions and a lot of confusion about how to don, how to doff. I'm even familiar with people calling their chickens don and doff now because, you know, it's just their catch cry of 2020. So we're wanting today to just ensure that everyone's got an overview of the right way to don and doff. So to that, not to just don and doff, but to use PPE broadly around the community and within whatever setting you're working in. So joining us today, I can welcome back a couple of familiar faces and one new face. So we'll start with the familiar faces first. Dr. Lin Lee Lim, if you could give a little wave here, Lin Lee, that would be great. Lin Lee is an infectious diseases physician at Eastern Health and a researcher at the Doherty Institute. Lin Lee is a highly experienced physician in infectious diseases and infection prevention and control. Our second familiar face is Anne Wunsch. Anne Wunsch is the Executive Director of COVID-19 Task Force, of the COVID-19 Task Force at the Aged Care Quality and Safety Commission, and has been working with a number of services both in New South Wales and Victoria and Tasmania as they've dealt with COVID-19 outbreaks. So Anne is the Commission's representative at the Victorian Aged Care Response Centre, and she leads the prevention team. And thirdly, we have Marie Somerville. Marie, welcome. A bit of a wave.
Thank you.
Marie is a Senior Infection Prevention and Control Nurse at the Victorian Hospital Acquired Infection Surveillance System. And there's a very long acronym that will be even harder to say than Victorian Hospital Acquired Infection Surveillance System. Coordinating Centre, supporting development of infection surveillance plans. So a big thank you to our panellists today. We've got a lot to get through, so we will move on with the presentation. Thank you so much, ladies, for being available for us.
Thank you very much, everyone. This talk lends itself nicely to a lot of questions that were asked in our previous Friday Lunch and Learn session, which was around facility outbreak management plan. So my intention is not to repeat the content that I provided at that component of the talk, but actually to extend on that and particularly focusing around PPE, which, as Sharon has already flagged, is likely to create a lot of questions that we'll cover. But the way I think of PPE is looking at what we should be using and then covering areas as to how we should be using it, including donning and doffing, PPE, extended use, and then how we dispose of it. And in the current setting in Victoria, how we're accessing PPE via ordering systems, and also what we have in Victoria with respect to PPE training.
I'd like to add that what's really important is to understand a safe practice. And if there are slight variations in practice, what we need to ensure is that really the important outcome is that your use of PPE does not lead you to either contaminate yourself or anyone else. So PPE should be your defence. It's the defence for you, your colleagues, the people that you are delivering care to, the families of those people, your family and the community. And it is the only defence we have now in relation to COVID-19. So it's our critical defence. But what we will take you through is a process today that is simple and straightforward, acknowledging that you may have seen slightly different processes. But remember, the best process for you is the one that keeps you safe, and that is the one that prevents you from accidentally or inadvertently contaminating yourself from touching the outside of contaminated PPE. So always remember that when we give you this information and advice, it's because that is the outcome we are seeking for you and for everybody else. The other is that we will address this seminar to the circumstances in Victoria and reference Victorian state guidelines. But a lot of the material that we will be discussing is just as relevant to other states and territories in that it has general applicability. Some of the illustrations we'll use at the end of the slides will also be generally applicable because they are risk mitigation strategies for locations that don't currently have a COVID outbreak. So we will talk about the things that you could do to better protect the facility you work in, regardless of the location of it and regardless of whether it has active outbreaks in the near vicinity. Okay, enough from me. I'm handing back to Lynn Lee, who's going to take you through the slides. Thanks, everyone.
Next slide, please. What I wanted to take you through is what's the current Victorian DHHS guidelines around PPE guidance for residential aged care. And these are the guidelines that are in place at the moment in Victoria. So what do these guidelines show? They say they define when we are expected to wear PPE. So the expectation at the moment is all staff and visitors entering the facility are required to wear a mask. And for staff, it's mask and face shield or some form of eyewear protection, preferably face shield, but goggles are also appropriate when providing clinical care in clinical areas or resident-facing areas. Personal eyewear provides inadequate eye protection. And the other flag, as I mentioned, these requirements for mask and eyewear protection applies to not just clinical staff, but any staff entering what we call clinical or resident-facing areas. So I've just provided a table from this particular guideline, which nicely illustrates the requirements, the PPE requirements in what we call facilities that are white, so facilities that do not have any suspected or confirmed COVID activity.
And I can pick up there just, Lynn Lee, a question that we already have on the chat, and that is this required in areas where there is no significant community transmission? And the answer is yes. This is expected across Victoria in all residential aged care services. It's not related to community transmission.
Yes, that's right. Now, the next table is around what is required if a facility has areas where, for a term that I'll use is a COVID area. So that covers an area in a facility that we have a resident that may fulfill the status of suspected COVID or confirmed COVID positive. So the requirements around PPE in these areas that the PPE required is with respect to mask, it's not a surgical mask, it's a P2/N95 respirator / mask. Eyewear protection is similar to the normal setting, which is face shield, disposable gloves, and gowns, disposable fluid repellent gowns. So there's 4 elements to the PPE above and beyond hand hygiene practice. If residents need to leave the room, they should be encouraged to wear a surgical mask if they can tolerate. Currently, this visitors attending facilities is not a common scenario, but this guideline does point out that should visitors be entering the facility, they are required to use the same PPE as staff, and it's the obligation of staff to educate and help the visitors don and doff.
Lynn-Lee, just another question that has come through already. Yes, it is a requirement for staff to wear a mask, even if there is not a confirmed case. It's a requirement that staff in residential aged care services, all residential aged care services in Victoria, wear a mask. That is the DHHS guideline. It's mask and face shield, but it is absolutely the case that the mask must be worn, and it's not related to whether you have a COVID case or not. It's a minimum requirement.
That's right, Anne. The mask is a surgical mask if it's in a non-COVID setting. However, if it's in a COVID setting, as I mentioned before, it's an N95/P2 respirator. Face shields are used to provide eye protection when providing direct clinical care or in residential or clinical facing areas. And the DHHS guidance is that reusable can be a choice over single use where possible. But if we're using reusable, there should be a process in place to ensure appropriate decontamination and storage between users, such as meal breaks and end of shift. There are Commonwealth guidelines around PPE use in settings of increased community transmission. So I've provided a link there and the guidance is put out by the Commonwealth Infection Control Expert Group. And a key point with respect to this particular guidance is that for health and aged care workers, this guidance advises that the advice of the state and territory should be followed, irrespective of the content in this particular guidance. We should be following the Victorian DHHS guidance. Next slide, please. So with respect to the specific items of PPE, starting off with masks. So surgical masks are what is in use on entering any Victorian aged care facility. And then in COVID areas, it's using a particulate filter respirator, which is covers off on masks such as P2/N95 types. And P2s and N95s are a type of mask which has fulfilled certain testing requirements where they actually, under testing conditions, they've been shown to filter out at least 95% of very small particles, up to 0.3 to 0.6 microns, which are the size of infectious particles, such as viruses and bacteria. With respect to KN95, it does fall into the category of particulate filter respirator. And there have been quite a few questions coming through, I think, in the previous session around this. So with respect to what is suitable for use as a P2N95, on the current ARTG site, which can be linked via TGA, there are, when I checked yesterday, there are 2 brands of KN95s that have passed Australian testing that can be suitable for use. I am aware that there are some facilities that have stock of KN95s. My advice would be to quarantine that stock at the moment and check this ARTG site regularly. But unless the product is on the ARTG site, it is not currently licensed for medical use in Australia. So to summarize, the recommendation is to quarantine your current KN95 stock unless they are one of those 2 brands that are up on the ARTG site currently, but to check the ARTG site frequently as further brands complete testing the site will be regularly updating. Other points to make regarding masks, particulate filter respirators with valves should not be used, as there is a risk that the exhaled air from the infected wearer will contain infectious viral particles. So what that means is if you are wearing this sort of mask and you have COVID, you would be fine from other people, but you could actually spread the infection very effectively if you're wearing this sort of mask. Healthcare workers who use these respirators need to be trained in their correct use. Unless that occurs, they will not be effective and the risk of infection can increase. So fit checking is recommended, and that is around making sure and ensuring that there's a good seal on the face. Staff should also be comfortable with knowing how to remove them safely. The advice is that being clean shaven can potentially help achieve a better seal on their face, and cloth masks are not appropriate.
Lynn Lee, I noticed one of the questions that came up was around should everybody, if everyone has or if they have thousands of KN95s that are not registered on the ARTG, then should people dispose of them? Can you just talk to how they could be used in a circumstance where there wasn't an active outbreak?
Yes, I'm definitely suggesting that don't dispose of them. They can be used in two settings. The first is they can be used as part of general use. In place of a surgical mask, it's fine to use it in that way. But the other option as well is to quarantine this stock and to check the ARTG site regularly, because even though there's only currently 2 brands on that site at the moment that fulfill the criteria of being a P2 N95 respirator, more brands may come on with time.
Okay.
I think, Anne, it's Sharon here. If I can just reflect back to another question that's come up into the chat. One is, are these guidelines for non-direct care staff as well? So kitchen,
yes,
catering, clean.
So when you look at the DHHS website, you will see that it does talk about all staff. So, and really what we're trying to do here is explain how coming into an aged care facility as a staff member, for the majority of staff, involves a moving through the facility and not just being just working in one particular area. So most staff will move around the facility in their role. If they work in the laundry, they will probably come out of the laundry at some point with a trolley to collect items from in a corridor or in another room. If they work in the kitchen, they're likely to be involved in moving through the facility. So for the vast majority of aged care staff, they are unlikely to have a role that would only involve them being in a single space where they have no resident contact.
I would echo Anne's comments. So I would encourage us to think of areas in the facility as clinical or areas that residents are in. And if there's staff that work in the laundry or work in the kitchen, but they're entering these areas, they will be required to adopt the PPE requirements of that particular area.
Yeah, thanks.
In saying that, if when they are cooking in the kitchen and they are leaning over a saucepan and there'll be steam coming to their face, clearly it would be unsafe for them to have a face shield on at that point, because there might be a risk for them burning themselves or not being able to undertake their work safely. So they would apply that face shield when they were moving from that kitchen area out into a space where they're coming into resident contact. So certainly we want people to be pragmatic about this and understand the risk, and understand that the purpose of a face shield, and this goes to another one of the questions on the chat, the purpose of the face shield is to protect you from touching your face and touching your mask, because it provides an additional barrier to your face. So the role of the face shield is a secondary protection, and it protects you from what is, we know, a difficult requirement, and that is that you don't touch your face or your mask during the time that you're working.
Next slide, please. So the next element of PPE is eyewear protection, and we really touched on face shields and goggles. As Anne has mentioned, the face shields offer the additional benefit with respect, apart from eyewear protection, it does provide a physical barrier to us touching our masks. With respect to either of these items can be ordered as a reusable item, and below I've provided a link with respect to some guidelines on appropriate cleaning and disinfection of these if they are reusable items. Next slide, please. Gowns. The requirements with respect to gowns are that they're they don't have to be sterile. They can be non-sterile, disposable patient isolation gowns used for routine patient care, and they're appropriate for use with patients with suspected or confirmed COVID-19. With respect to the next item, which is gloves. Non-sterile disposable patient examination gloves, which are used for routine patient care and healthcare settings, are appropriate for residents with suspected or confirmed COVID-19. Just a reminder, no double gloving when providing care, and extended length gloves are not necessary. I think there have been some questions from the previous session that we had with respect to the composition of the gloves. So there's the general types of gloves that are in use are vinyl, latex, and nitrile. From the chat, a lot of the questions were around when were vinyl or latex gloves appropriate. They're appropriate for standard resident care. However, in a COVID setting, as part of your PPE outbreak management pack, we would be recommending, similar to your order with respect to gowns, P2N95, and eyewear protection, that the gloves should be nitrile. And the reason why the recommendation in COVID setting that they should be nitrile is that they are less porous and less likely to tear. Next slide, please. With respect to hand hygiene, obviously hand hygiene underpins multiple steps in the PPE donning and doffing, and also part of performing it regularly at times throughout in the work setting actually protects us and protects residents. So it is important for staff to perform hand hygiene after removing PPE. The recommendation is to use an alcohol-based hand sanitizer that contains at least 60 to 95% of alcohol. The other option is washing hands with soap and water for at least 20 seconds. However, if we're washing hands multiple times throughout the day, I think our hands will really suffer for it. So our preference is actually to use regular alcohol-based hand sanitizer or alcohol-based hand rub as much as possible at required time points. And if hands are visibly soiled, then the preference would be to use soap and water. With respect to donning and doffing, this is what the current Victorian DHHS guidance is with respect to donning and doffing. And I would appreciate that there are different variations with respect to procedures that are actually in use out there at the moment. I've just chosen the Victorian DHHS ones. So for facilities that don't have an end-trained or ingrained procedure at the moment, this is what we're promoting that facilities should adopt. This is signage, again, from the Victorian DHHS site. If we ignore the fact that we're not nurses or midwives in the aged care setting, the remainder of the content does match the guidance on donning and doffing. So this signage actually has two options with respect to doffing, which I've highlighted in boxes. So on leaving the patient zone, one option is to remove gown and gloves together. The second option is to remove the gloves first, perform hand hygiene, then remove gown. With respect to PPE extended use, this information is also available on Victorian DHHS guidelines. With respect to masks, just a reminder, it's use up to 4 hours, but please do change them earlier if damp, soiled, or visibly contaminated. With respect to gowns, you can wear them for an extended period in a zoning setting. So if the zone and your particular facility, the most common scenario is that it's a single resident in their own room, that means that that zone is the resident's room. So when you exit the room, it means that the gown needs to be removed. With respect to eyewear protection, if it's single use, it can remain on for the entire shift, but obviously you would need to change earlier if leaving a COVID zone or area, if that was in place at your facility. Some other general points that I wanted to make with respect to PPE use. Change of gloves is required between every patient interaction. Where a PPE item is labeled as single use, it must not be reused. Remove and dispose of all items before going on a break and replace them before resuming work. Where single-use face masks, face shields or goggles are used for extended periods and are needed to be removed to eat and or drink, then just to remind staff that hand hygiene and sanitizing should be maintained. When healthcare workers are assisting the patient or resident in showering, they should wear a mask and face shield and then change the mask after the task. I'm not going to go through this in much detail, just to put it up there for the sake of completeness. This document has been covered in previous sessions. Next slide, please. PPE access, this is what's currently in place in Victoria. Facilities are accessing PPE via the usual supply chains. Using national stockpile, an urgent access trigger is because when the DHHS Public Health Unit is notified with respect to an outbreak, and these are the items that are sent in the PPE emergency pack to keep the facility going. And then subsequent ongoing needs are via Commonwealth request to the national stockpile. This is the current training that is being provided to aged care staff in Victoria. So face-to-face training via Monash University, and that's for clinical and non-clinical staff. Facilities are taking up the opportunity of, because the training can be offered on-site, provided physical distancing can be maintained, and the course includes a component of a train-the-trainer model, which ensures sustainability of ongoing training for staff that might not have been able to make it that day, or agency staff or other staff that are recruited. Online training is also available via the Commonwealth and Monash Health sites. And I've provided about everything that I've covered in the slides today. I've provided links to the resources referenced.
Thank you so much, Lynn Lee. It's great to have had all that information in one place. We have got a number of questions that have come through, so I'd ask you to keep them coming through. I'm going to throw to Anne Wunsch, and she will answer as many of the questions as we can. But I can first tell you, Hayley, yes, you will get a copy of the slides. The slides and the webinar will be available for everybody once we're finished. So, Anne?
Yep, and I've also got a message for Hayley as well. You're getting a lot of one-to-one attention today, Hayley. Look, the training that is provided through this series of slides is consistent with the information that has been provided to assessors, and assessors work for the Aged Care Quality and Safety Commission. The Quality Agency ended its operations back in 2018, but those assessors have this particular sequencing of donning and doffing as part of the information that they use when they are conducting infection prevention control visits. But if you are concerned about something that's happened to a particular service that you work for, please provide that information to me, and I'm more than happy to look into it for you. And if you want to provide it through Sharon, Sharon knows how to get hold of me 24/7. So she'll provide that information to me. The other, I suppose we have covered a lot of this material already, but it is the case that it's mandatory to wear face masks in residential aged care for all parts of that service. So it's regardless of the position the person holds, face masks are mandatory. We have said today that face shields should be used in all circumstances other than when they're going to compromise the work that the person's doing. For instance, in a kitchen or in a laundry where they are encountering steam or something that might fog up their shield. Otherwise, face shields should also be used. This includes kitchen staff and laundry staff and all other staff. The reason for wearing masks and face shields is because it's the only protection that we currently have available to us to protect against COVID-19. There is no other defence. PPE is your only defence, and we need to keep repeating the messages about how 100% compliance is critical. The question about so should visitors also have shields? Visitors should wear masks, surgical masks. And if a visitor comes in a cloth mask, they should be provided with a surgical mask. That's reasonable. A visitor's not going to be working or spending an extended period of time in a service and is unlikely to be coming into contact with multiple residents. And so a surgical mask is appropriate.
Oh, I was just going to say, you just froze for a moment there. I was just
right. Okay, so I think back to the question, another one for Hayley. This session is for everyone though, not just for Hayley. Is vinyl acceptable? Well, I think we said that vinyl is acceptable and latex is acceptable. And in the instance where there's an active outbreak, nitrile is the preferred glove because it offers additional protection.
And one question that I'm just seeing now is, in the absence of being able to buy nitrile gloves and therefore needing to continue using vinyl, is there any recommendation for when to actually change those gloves, the vinyl gloves?
Change to something else, Lynley?
Obviously you would change them every time you're changing doing something different with a different resident or washing your hands as per normal.
That's right, Sharon. I think you've answered you've provided my response, correct. So with respect to changing gloves, the most common time that we change gloves is between resident care and perform hand hygiene as well. Do you think the question was around the types of gloves, like when you would change the type of gloves, or is it just when you would change gloves?
I think it's a frequency of,
Yeah, okay. Marie, did you want to add to that?
No, that's the correct answer. You change as you would any glove when you're going between different activities with the resident, or if you're leaving the resident's room, you would definitely change then. Or if they become dirty, of course, you would change them and perform hand hygiene and put a new pair on. So they're the times you would change any glove. So the rules apply for vinyl gloves as they do any other pair of gloves.
And I think it's appropriate here too, just to reiterate that we are talking specifically about the Victorian situation at the moment. So these rules that we have in Victoria don't necessarily transpose to other states at this point in time. Is that correct, Anne?
Sorry, can you repeat that?
Just there's a couple of questions about what do we do in New South Wales and what do we do in South Australia. Now they have different rules at the moment because they don't have the COVID outbreaks that we've had here in Victoria.
Well, in Victoria, the Department of Health and Human Services issues its own specific information and guidelines specific to Victoria, and the Commonwealth guidelines spell out explicitly that services need to follow state or territory guidelines that are relevant, so to residential aged care. So in any state or territory where there is a combination of Commonwealth and state or territory guidelines, you need to apply both. So the DHHS guidelines are relevant to Victoria.
Thanks, Anne. And there's a question here from Yulia, who had the DHHS prevention team visit their home this morning and advised them that they needed to replace all of their vinyl gloves with nitrile gloves, and they're not in an outbreak. So clearly we've just said that in the absence of nitrile gloves, you can use the vinyl gloves that you've got.
And that is the DHHS, the DHHS don't say anything different. So that's interesting. If that would be useful feedback to provide back, I think.
Yeah, and I think another useful piece of feedback, and I haven't seen this PPE video at this point, but a Commonwealth communication today included an updated PPE video, and of course it's a Commonwealth-based one and does not refer to face shields as suggested by the Vic DHHS, which makes it then a hard to promote video. So I think, as Anne's just rightly outlined, we are under DHHS directions.
That's right. Yeah. And look, and Erin's question about can you define a resident area where face shields should be worn? When you read the DHHS web's the advice for Victoria, and I'm assuming, Erin, that you're in Victoria here, what it's saying is all staff should wear them. If the kitchen is an area that is excluded from residents because it's an area residents cannot enter, then it's not a resident facing area, and therefore there wouldn't be a requirement if you're cooking in the kitchen to have your face shield on. When you leave that room and you move into another part of the facility, then you're moving into what would be a resident facing area or a resident area, because people can move about in their own home and they can go down corridors and they can go into other spaces. So that really is just telling you that other than if you're in the kitchen, or other than if you're in a laundry or in a maintenance area that is where residents do not enter, then you are in a resident area. So you would be using your face shield in all other spaces in the service and in the grounds where people are moving about outside, because residents are likely to be there. But there's one other reason why you want to be consistently wearing your face shield, and that is you need to look after your colleagues and they will look after you as well. And you need to know that they are complying with appropriate PPE usage. If everyone consistently uses the right PPE, then you can be confident that you are safe at work and they are safe at work. if people are inconsistently applying PPE, then it's much harder to have appropriate surveillance across the service. So using the guidelines consistently is the safest approach, and also provides your colleagues and residents and families with confidence that you are protecting them and yourselves from COVID.
I might just let you catch up on a couple of the questions, Anne,
Yep.
and just ask Linley and Marie, there's a question about, it goes back to PPE if you don't have COVID. Now, are gowns included as it's mandatory PPE if you do not have COVID in your service?
That's correct. So
Okay.
if you don't have COVID in your service, or you're in a zone that is separated from a COVID outbreak, so it's completely free of COVID, you just we are required to wear masks and face shields in that setting, but everything else is based on standard precautions. So you would do your hand hygiene in accordance with standard precautions, and you would do you'd wear gloves in connection with standard precautions. So if you're doing a particular procedure or and so forth, that in that sort of setting. So that's what you would have in a normal situation where there's no outbreak.
Great, and that was on one of the earlier slides that everyone will have, wasn't it? It was in one of the graphs with the ticks and the crosses.
Yeah. So there is a graph there that shows what standard precautions, where to wear a mask. Because Victoria's in an outbreak setting, we are all required to wear the masks. As you can see, both Linley and I are wearing masks now because we're in the same room. So everyone is wearing a mask. So that applies to the same when you enter an aged care facility. And also then they have to wear, on top of that, if they're front facing, the shields. And that's what we are now, that's our COVID standard precautions, if you like. That's my new word for that. But yeah.
Thanks, Marie. And we are running out of time, but Andrew he's had 3 goes at getting this question written out for us. Does one clinical waste bin need to be placed in or outside the resident's room to remove gowns, gloves, etc. during an outbreak? And does one clinical waste bin need to be placed outside to remove masks and shields during an outbreak?
That's a great question. Thanks for asking that. The answer to that depends on your zone. So the most common outbreak, so in Victoria at the moment, what defines an outbreak is if you have one resident that fulfills the criteria of suspected or confirmed COVID, so one resident. So the most common scenario that facilities are in is where the resident room is the zone, the COVID zone, the resident room. And so the requirements around that, in terms of location of the clinical waste bin, is obviously you put on all your PPE before you go into the room, but it's at what time do you take what components of your PPE off as you leave the resident room, right? So if the zone is the resident room, the recommendation is that you remove gloves, then gown, performing hand hygiene appropriately in between, while in the resident room, okay? So that will require a clinical waste bin and alcohol-based hand rub to be available within the room. And then as you step out of the room, then you remove the eyewear protection, so face shield, and then the mask. So that would require a second waste bin for removal of PPE outside the room. Now, there needs to be kind of practicalities considered around this. Some facilities are not able to have the clinical waste bin outside the corridor for reasons, specific reasons, such as the corridor would be considered a clean zone, and if there was one a potentially dirty COVID waste bin in there, could we adequately protect that waste bin from other residents that are using that corridor? So that needs to be taken into consideration. If that's the case and it's deemed that that clinical waste bin would be a risk to the residents in the clean area, or that that's a corridor. Then there is advice from the DHHS infection control team, which Marie is actually part of, which is that provided we can maintain a 1.5 meter distance away from the resident, we can also remove our face shield and mask within the resident's room prior to stepping out. So that was a very long-winded answer to a great question. I hope that was clear, but happy to follow up on that if required.
And ideally too, the waste bins, they can be open, but they should not be, they should either, ideally they should be pedal, what do you call it? Foot pedal operated.
Pedal
Ideally.
bins.
Pedal bins. That's the ideal. Now, rather than a swing top, because that way you'll get you'll get contamination on the outside of the swing top. So I have seen open bins, and that's possible if you don't have people likely to go through the bin. If you have a very controlled environment, but that might be a risk. So I think always the goal would be to have pedal bin operated systems.
The other thing to add to that as well is loose bags that are that don't have a rigid frame to hold onto the structure of the bag actually pose a risk, because as the bag becomes fuller and fuller, we're more likely to contaminate ourselves when we're putting in, and we can touch the sides of the bag.
Thank you so much. We are running out of time. In fact, we've just gone a little bit over time. And was there just a final question that you wanted to answer, or?
Oh, look, I just saw that you were interested in the question about hijabs and turbans. When we're talking to staff about their the clothes that they wear to work and the clothes they wear at work, we do recommend that it is appropriate to change at work into your work clothes, and then at the end of your day change into clothes to travel home in, or if you do wear your work clothes home, to immediately change them when you get home and put them straight into the washing machine and not wear them around the house after you've spent a day at work. And this is particularly, the sites we talk to are particularly those where they've got outbreaks and staff are thinking about how to protect their families and their loved ones when they work in aged care. So it may be appropriate for staff on arrival at work, if they do wear turbans or hijabs, to change into the clothing that they will be wearing, including their cultural clothing, for work. So, I mean, I think these are all reasonable approaches to use, but I think they should always be managed sensitively with staff so that staff feel respected and valued, and they understand that these recommendations are being made to support their health and welfare alongside their colleagues and everybody else's.
Thank you, Anne. And look, I will draw a line in the sand here as far as questions go, but I will take, I will get the questions delivered to me or sent to me, and as will Anne and the VARC, and we will try and pull them together and categorise them, and perhaps put a frequently asked questions, you know, an FAQs out that everyone can access, because there's a lot of really great questions here that we do need to spend some time clarifying. So if you could just give us that time, that would be great. And we will see you again next Friday when we have our final Lunch and Learn webinar, which will be about lessons learned. And I know, you know, for me, the interesting thing is we've seen lessons learned videos from overseas. We've had our own webinars here in Australia. And I can honestly say that we are still learning on a daily basis in the aged care space. You know, something new or something that someone hadn't thought of still comes up very, very frequently, and you know, and we're agile, and I think that's the beauty of all of these webinars. So See you all next Friday for a lunch and learn at 1 o'clock, and that will be with Joe Buffoni and Jared Mansour. So we'll see you then. Thanks everyone. Have a great weekend. It's Friday.
Thanks everyone. Happy Friday.